Hi there! Grab your coffee or your tea because I'm gonna tell you the story about when I got appendicitis and I was pregnant. A really quick introduction right here. My name is Maria Segovia and I have a 2-year-old. I am married with Lou and we currently live in Ireland, but we're from Costa Rica. Okay, so it's November 14th. And I was working in a hospital as a service controller, which is like I was taking care of all the patient experience program there. And I had been through a whole process of infertility with my husband and fertility treatments and everything to get pregnant. So this precious child of mine that was in my tummy was very monitorized all the time, ultrasounds and blood work and everything to make sure that he was fine. You know, a lot of women get very sick on the first trimester, and I did. I got sick and I was not feeling my best. Though I have to say I never threw up in my office, even though I really wanted to, because of the idea that throwing up in the trash can or in the hospital bathroom, just I couldn't imagine that. So yeah, I was, you know, sick in the first trimester, and then right when I was finishing my first trimester and going into my second trimester and I was finally feeling better, I got appendicitis. So on Sunday, November 13th in 2016, it was a Sunday and we were having this great party that we have with all my husband's cousins in Costa Rica, and we were just having a blast. I was 18 weeks pregnant and feeling wonderful and lots of activities, and you know how I just loved being pregnant. I was what I thought it was glowing and feeling my best, and I was happy all the time. I never had a stomachache again and I was feeling great. And that day we had to leave that Sunday because my husband was going on a business trip to Colombia and Brazil. So we did. I left him at the airport, drove home, and I remember I was having this call with a friend of mine that at that time she was living in the Netherlands, and we were talking. I was like, you know what, I don't feel well. I feel like I have like a stomach ache, and maybe, you know, like maybe it's my husband leaving or maybe whatever, because I kept telling him, and he traveled a lot, but I kept telling him, don't go, like I don't want you to go. This is the first time. I don't want you to go on the trip. Don't go. Anyway, he left and I wasn't feeling very well, so I just thought it was normal. And that Monday I woke up and got ready to go to work because I was working at the hospital. Now, since I woke up, the first feeling I had was I got colitis or something like that. Like I'm not feeling well, maybe it's just stress or something, and I got colitis or something like that. I went to work and I remember telling my coworkers, you know, my team that we work together, I'm not feeling well today, you know, like I think I have colitis. And so my job was also to go visit the patients in the hospital, but I remember doing the visit and I was just in this pain, like that wouldn't let me go all the way straight. So one of the nurses, he asked me, are you okay? I'm like, you know, I just got colitis. It's just this baby, maybe he's in a bad position or something and he's messing up with my colon, but I just, you know, I got colitis. I actually went to have lunch and I had some chicken and mashed potatoes. I mean, there were a lot of other things, but I just felt like eating that because it was soft food, you know, like something that would be processed really fast in my tummy. So I had lunch, and after lunch, every day, my coworkers and I, my team and I, would just walk through this very nice avenue that is next to the hospital. And we would just walk there and maybe have an ice cream or just talk through this hour that we have for lunch. So we would eat and then go walk, come back, get ready, and then continue with our work through the day. And we are halfway through the parking lot of the hospital. And I just feel this sharp pain in my tummy. And I just feel very nauseated, like I'm about to throw up. So I told them, I don't think I'm gonna keep walking. I'm just gonna go back to the office and relax there for the rest of these minutes that I have, and then I'll continue to work. So I came back to my office and I'm just having a really bad pain, like like my stomach is in pain, like you're having a stomach ache. But then it was more and more. And there's certain signs for appendicitis that you look for. And I even checked in my head, okay, I'm not, well, at that time, I'm not throwing up. I don't have pain in my leg. I don't have pain in my lower abdomen when I push or release and all that. I don't feel it. It wasn't there. It was just a complete different pain. So I called my OBGYN and I told him, look, there is no way this baby can be okay with this type of pain. Like, what is going on? Like, I don't think it's a baby. I just think it's me. But I mean, I might affect the baby because I'm in such amount of pain. And he said, okay, let's do this. Go and take this medication for now for the discomfort. Go and get a blood work, because he said there's nothing I can do. You can come and I can do the ultrasound to check that the baby's all right, but I need those readings first just to check that everything's okay. So go ahead, do the blood work, and once it's done, come to my office. I'll run the ultrasound and we'll just make sure that everything's fine. So I went downstairs and I paid for my exam. I went there and I said, I need this exam. It was like a general hemogram or something like that. And then I don't know how I was looking, because I was feeling really miserable, but they were like, okay, we're having the results really quick. Why don't you sit down here? I'm like, no, I'm just gonna come back to my office and relax there while you have the exam ready. And they're like, no, like sit here and wait for the exam. So I'm like, it's okay. I have a more comfortable chair in my office and I'm gonna go there, and when it's ready, just call me and I'll get back here. And they're like, well, the thing is that we can't let you go right now. So I'm like, what do you mean you can't let me go? What? So she said, no, you have to sit here because my boss said that you needed to be here until we have the exams results. And I thought that was weird, but I really didn't know how I was looking, and apparently I was really looking pale, like I had no color in my lips, and I think it's just because of all the pain. So I'm there sitting, feeling miserable and waiting for the results, and then I see the director of the hospital shows up, and the quality director shows up, and my team shows up, and I'm like, I'm not sure what's going on. And they're like, how are you feeling? You know, they were just following up. And then my boss, which is the quality director there, he said, have you had an ultrasound done? Like a abdominal ultrasound done? I'm like, no, I'm just gonna have this blood work done, and then I'm gonna go check with my doctor for the baby ultrasound. And he said, no, you are not leaving this hospital without the abdominal ultrasound. And I remember getting into an argument with him because I'm like, well, I don't know, because I don't know if I'm gonna pay for that, and nobody has authorized that yet. And and seriously, he's like, well, I authorize that now and you have to have that before you leave. So I got the blood work results, and they were a little funny, but again, since I was pregnant and that was not so irregular for the weeks I had. So a friend of mine that was there at the hospital, you know, working with me, she helped me to go to the to have the abdominal ultrasound done, and I did. And then the doctor is really pressing hard on my tummy because they're trying to look for the appendix, but they can't find it because it's not where it's supposed to be anymore, because I'm pregnant and the appendix went up instead of being lower where it's supposed to be. So he finally found it, and then he actually changed the head of the ultrasound machine thing, and then he pressed again, and I remember saying, ha! And then he waited, he didn't say a thing, and then he all of a sudden he just he let go really fast, and I screamed like I couldn't help it. I was like, ah! He's like, I'm sorry, but you have to call your surgeon, because I cannot say it's appendicitis, but I think it is, and this needs to be evaluated by your surgeon. Now, the doctor that was doing the ultrasound, he's a doctor, he's not a technician. He's a doctor, and he's like, I can sign on this, but I think you have appendicitis. When he said call your surgeon, I cannot explain you what went through my head. I was like, a surgeon? But I'm pregnant, like 18 weeks pregnant. How can I call my surgeon? And so I'm like, okay, I'm thinking about this doctor or that doctor, because I worked at the hospital. I knew them all, and they're very good. And he said, well, this doctor is not here. He's, you know, if he comes, he would have to come from this other hospital and then drive this amount of time. So I'm like, okay, I'll call this other doctor, and we're very close. And I called him, and I'm like, well, doctor, I'm at the hospital, and the thing is, and I start crying. And I tell him, the thing is, they said that I need a surgeon because apparently I'm having appendicitis, but I cannot believe I'm having an appendicitis because I'm pregnant. And then he said, stop crying, don't worry, because I'll worry for you. So that gave me a lot of peace. He was like, I'll be there in 10 minutes, which he was. So he went and reviewed the exams and he said, of course. They took me to the emergency area at the hospital, because that's where, you know, the little beds are. So he started checking on me and he did the same thing. He finally found the appendix, pressed really hard and then let go, and then I screamed. And then I'm like, oh geez, this is appendicitis. And he said, this is appendicitis, don't worry, everything's gonna be well. And this is a doctor that knew our journey through infertility. So he knew. I mean, all babies are important, but this one we fought for 2 years to get. So he said, you know, is there anybody that I need to call? I'm like, my husband is out of the country. And anyway, everything was really fast. So the doctor started to say to all the nurses, get her ready, get her ready, get the OR ready. And he's like, but he seemed to be sort of concerned, as in, because I thought, well, if I have appendicitis, can I have the surgery in a few hours? You know, like I get to talk to people. And he's like, no, you need to have the surgery right now, because I don't think this is okay. And that was very scary. I remember having like seriously seconds to pray and trying to connect with my baby and with God and say, okay, and explain. I remember I went to the bathroom and said, baby, this is what's going on, and we're gonna go through this, and you're gonna be fine, and we're gonna go through this. And I also remember talking to God and just thinking, just feeling peace, because, you know, I also thought, well, I might die, and there are no regrets if I die today. The only regret will be that I would have liked to live to see my baby, but that was very intense for me. And it was intense because I was grateful that I didn't have any regrets that day if I were to die. So anyway, the first call was to my surgeon. The second call was... Anyway, the first call was to my surgeon. The second call was to my OBGYN. And he said, I'll be there as fast as I can. But don't worry, your baby is still 18 weeks old. This is great because he's small enough to be moved in order to get your appendix out. Crazy. I know, it's crazy. And the third call was to my uncle, who's like my father. And I called him and I said, I have appendicitis. And then he said a bad word, and then he said, I'll be right there. And then within 10 minutes, he was already there too. I was wearing my uniform, and then I was wearing the green gown that they give you, and I was all concerned because I had my lunchbox and purse and my stuff there, and I had a little dog back then that needed to be fed. So, you know, my family took over everything, the house, that dog, that car, my stuff. And my boss got the phone and called my husband to Brazil, and he said, don't worry, this is, you know, Maria's boss. I just need to tell you that she's gonna go in through surgery. And I actually took a picture and sent it through WhatsApp to my husband for him to know that I was gonna be fine. But I know that it was very hard for him not to be in the country. Anyway, I went through surgery really fast, and they gave me something for the pain, for sure. And I was still feeling pain, but they just gave me something through the IV that was really comforting, and I started feeling better because I was just in bad pain. And the anesthesiologist, you know, started talking to me, and he said like, okay, we're gonna do this, and you know, you're gonna fall. And I was like, no, wait. Why am I going to fall asleep before going into the OR? He's like, why do you want to be awake for that? So I'm like, I actually want to see what the OR looks like. Don't fall. No, I don't want it. When I'm there, you can put whatever in the IV, but I want to get there. And I don't know, I just wanted to, it's crazy. I just wanted to get into the OR awake. So he did, and he gave me some time to do my prayers and do the Shema. And when I was there, he finally put the thing in the IV, and then I fell asleep. So I had the surgery and my OBGYN got there on time to see the surgery, but he didn't actually do anything. He was just there to make sure that everything was okay with the baby. And I got a laparoscopic surgery for my appendix, and it was already pierced. So because of that, I had to be in the hospital for 2 nights instead of 1 because of the antibiotics that I was getting. So my aunt and my sister got there and they took care of me for the whole time when I was at the hospital. They stayed with me overnight and everything. So the first night, my sister is the one that spent the night with me. And I tell you, like, that was one of the worst nights of my life because I had the surgery and I was doing well with the pain. I had no more pain in my stomach, but I had a catheter so I could pee. So after the surgery, like at night, they took out the catheter. And for whatever reason, that was so painful that, I don't know, 3 days, even after that was taken out, I couldn't go pee without crying. So that night, every time I felt like peeing, the pain was even worse than the appendicitis pain. And that was very hard because my sister was there trying, to help me, and I couldn't even sit well in the potty. And, the hospital has all these nice bars so you can hold on to, and it was just hard. I was holding to everything, trying to pee without the pain, but the pain was just, it was so hard. And, I got checked by the doctors and everything seemed fine. And apparently you can get irritated a little bit because of the catheter, and that sometimes happens. And that's what happened to me. And that was a terrible experience because I was in such amount of pain, and then after that, the whole soft diet that you need to go through. I was getting these juices and special gelatins because I don't eat pork, so they brought like veggie gelatin and Gerbers and stuff like that, and everything went fine. My husband called me the day after and he says, "Do you want me to come?" And I'm like, "No, you're in your business trip, everything's fine. I'm out of danger now, and I'll be fine. I mean, just continue your trip. I'm just not gonna stay in our house because it's on a 2nd floor and I can't be on my own right now. Like, I can't cook, I can't move." I mean, I could, but I was really slow. So I went to live at my grandparents' house, which is 4 blocks away from my house. And that was fun. And my grandma cooked every day, and I had my family coming to visit, and I was able to rest and recoup. And after a week, I went to my house and spent some time alone there. Every time I would still go to my aunt's house to eat and everything and to spend the day, but I would just come back home and sleep there. And it took several days before I was able to feel better. But after exactly 16 days after my surgery, I went to work. I went back to work after 16 days. So the baby was fine and I was fine. I did realize my belly looked way bigger than, where I left 16 days before. So anyway, I was able to recuperate from that. And that was definitely something very difficult to go through because you're so scared that something is going to happen to the baby if you have appendicitis and surgery. But it's more common than you think. So everything went well and I was able to recuperate well. But then there were the stitches. And that was a whole nother circumstance because I had laparoscopic surgery, which was great because it's very, very minimal invasive. And I still had 3 ports. So 1 in my middle of the tummy, 1 on my side, and 1 in my belly button. And another one somewhere else, but that was really small. And the one in my belly button, it got healed pretty fast. But then the other 2, those were something else because I was growing a baby inside of me and my belly was just stretching and I just had stitches on my belly. So that was not fun. I actually had a very hard time healing my stitches. I was able to put a lot of like healing creams and use other stuff, but that was something to take into account when you have surgery in your tummy and you're pregnant. But they did a great job, so I didn't have any hernias afterwards, thank God. And that was just great. Something that I wanted to say is that after having all these experience of having appendicitis when pregnant is the feeling of gratitude that came over me for months. And I still have it to this day, but it was very strong for months after this experience because I was just so grateful to be alive. I was just grateful that my baby and I had a second chance and we were alive and we were doing well. And that was just amazing, you know, to know that all the people, the right people were there for me, that I was in the right place when this happened with great surgeons. I actually had insurance, so I still had to pay a lot of money, but didn't have to pay for the full amount of the surgery, even though it was in a private hospital, because of this insurance that I had. And you know, everything just worked well, and I was just so grateful. That was the feeling that I think came after all this, just being grateful for being alive and for my baby to be alive. So I just wanted to share my story with you. Hopefully you take encouragement from that. And if you have had appendicitis while pregnant, let me know in the comments. When that happened, I didn't know anybody that went through surgery or any type of surgery while pregnant. And yeah, I thought that was just really weird, and it's not. I hope you like this video and my little long chat with you. Consider subscribing to my channel if you're new, and give this video a big thumbs up. Thank you for coming along. Bye.
Don't you know that you're beautiful, just the way